Have you ever walked out of a routine checkup feeling confident that you're doing everything right for your health, only to wonder later if those tests might have hidden risks you weren't told about? Every year, millions of seniors undergo medical tests they believe are harmless. But what if some of these very procedures could silently increase their risk of a stroke overnight? It's shocking to think about, yet buried in the fine print of modern medicine are risks that your doctor, the news, or even those clinic brochures might not mention. In this video, we're pulling back the curtain on 5 common medical tests that could carry unexpected stroke risks, especially for those over 60, and more importantly, we'll share exactly how you can protect yourself before your next appointment. You need to watch this until the end because being informed could mean the difference between a routine checkup and a life-changing health scare. Knowledge is your power to stay safe and in control. Before we begin, I would appreciate it if you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Let's dive deeper into 3 medical tests that, while potentially life-saving, carry hidden risks for seniors, especially those over 60 with conditions like high blood pressure, heart disease, or kidney issues. These tests, CT scans with contrast, exercise stress tests, and endoscopies, are often recommended as part of routine care, but they aren't always as benign as they seem. Below, I'll unpack each test in detail, exploring how they work, their benefits, the risks they pose, and practical steps you can take to protect yourself. My goal is to empower you with knowledge so you can have informed conversations with your doctor and make decisions that prioritize your health. 1. CT scans with contrast, a double-edged sword. What it is and why it's done. A CT, computed tomography scan with contrast, involves injecting a special dye into your bloodstream to enhance the visibility of blood vessels, organs, and tissues in the resulting images. If you've ever had one, you might recall the warm, sometimes uncomfortable flush spreading through your body as the dye takes effect. This test is a powerful diagnostic tool, often used to detect serious conditions like cancers, blood clots, aneurysms, or internal injuries. For many, it's a critical step in identifying life-threatening issues early. The hidden risks for seniors. While contrast-enhanced CT scans are invaluable, they're not without risks, particularly for older adults. The contrast dye, typically iodine-based, can place significant stress on the body's cardiovascular and renal systems. Here's why this matters for seniors. Cardiovascular strain. The dye can cause blood vessels to constrict or dilate rapidly, leading to sudden changes in blood pressure. For seniors with pre-existing conditions like hypertension or heart disease, this can be dangerous. In some cases, the dye triggers a vasovagal reaction, where both heart rate and blood pressure drop abruptly, causing dizziness, nausea, fainting, or even a brief loss of consciousness. Conversely, in others, the dye can cause a rapid spike in blood pressure, putting strain on fragile blood vessels. This increases the risk of complications like strokes or heart attacks, particularly in those with weakened vascular systems. Kidney impact. The kidneys are responsible for filtering and excreting the contrast dye. For seniors with reduced kidney function, common after age 60, the dye can overtax the kidneys, potentially leading to contrast-induced nephropathy, a form of acute kidney injury. This risk is higher if you're dehydrated, have diabetes, or are taking medications like diuretics. Research evidence. A study published in the Journal of Vascular and Interventional Radiology, 2019, analyzed outcomes in older adults undergoing contrast-enhanced CT scans. The findings were sobering. Patients over 60 with a history of hypertension, cardiovascular disease, or impaired kidney function had a significantly higher rate of vascular complications, such as blood clots or vessel spasms, within 72 hours of the procedure. The study reported a complication rate of approximately 5 to 7% in this group, compared to less than 2% in younger, healthier patients. A real-life example. Consider the case of an 81-year-old man who underwent a routine abdominal CT scan with contrast to investigate mild digestive discomfort. The scan results were normal, and he was discharged feeling fine. However, 2 days later, he experienced a minor stroke. After further evaluation, doctors suspected that the contrast dye had caused a temporary spike in his blood pressure, dislodging a small clot that blocked blood flow to part of his brain. While the stroke was mild, it left him with lingering weakness in his left arm, affecting his quality of life. This case underscores that even routine scans can have serious consequences for vulnerable individuals. How to protect yourself. Before agreeing to a CT scan with contrast, have an open conversation with your doctor. Here are key questions to ask. Is this scan necessary? Could a non-contrast CT, MRI, or ultrasound provide sufficient information without the risks? What are the risks specific to my health profile? Share your full medical history, including high blood pressure, heart disease, kidney issues, diabetes, or past reactions to contrast dye or medications. Can my kidneys handle the dye? Ask for a kidney function test, e.g., creatinine or eGFR, to assess your risk of contrast-induced nephropathy. Are there precautions we can take? For example, ensuring proper hydration before and after the procedure can help protect your kidneys. By weighing the necessity of the scan against your personal risk factors, you can make a more informed decision. In many cases, alternative imaging methods can provide adequate results with less risk. If you're still watching this video and finding these insights valuable, please comment number 1 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. 2. Exercise stress tests. Pushing the heart too far. What it is and why it's done. An exercise stress test, also known as a treadmill stress test, evaluates how your heart performs under physical exertion. You're hooked up to a heart monitor and asked to walk, or sometimes jog, on a treadmill while the speed and incline gradually increase. The goal is to assess heart function, detect blockages in coronary arteries, and identify abnormal heart rhythms. It's often recommended for seniors with symptoms like chest pain or shortness of breath, or as part of a routine cardiovascular evaluation. The hidden risks for seniors. While the test is generally safe for younger, healthier individuals, it can be risky for seniors, particularly those with pre-existing cardiovascular conditions. Here's why. Intense cardiovascular strain. As the treadmill speed increases, your heart rate and blood pressure rise rapidly to meet the body's demand for oxygen. For seniors with high blood pressure, weakened blood vessels, or undiagnosed heart issues, this sudden strain can be like pouring fuel on a fire. It may trigger dangerous blood pressure spikes, arrhythmias, irregular heartbeats, or, in rare cases, small tears in fragile blood vessels, particularly in the brain or heart. Risk of serious complications. A 2020 study in the American Journal of Cardiology examined over 1,300 patients aged 65 and older who underwent treadmill stress tests. The results were concerning. Nearly 7% experienced adverse events during or shortly after the test, including blood pressure surges, arrhythmias, and, in rare instances, heart attacks or strokes. The highest risk group was those with pre-existing vascular issues, such as hypertension or coronary artery disease. Vulnerable systems under stress. Seniors often have less resilient cardiovascular systems due to age-related changes like arterial stiffness or plaque buildup. Pushing the heart to its limits during a stress test can exacerbate these vulnerabilities, potentially tipping the scale toward a serious event. A real-life example. Margaret, a 74-year-old subscriber from Ohio, shared her experience. She had managed high blood pressure for years with medication, but was otherwise active and healthy. Her doctor recommended a routine stress test to check in on her heart health. Halfway through the treadmill portion, she felt dizzy and experienced tightness in her chest. The test was stopped immediately, but the next day, she suffered a minor stroke. Doctors later determined that the sudden spike in her blood pressure during the test likely caused a tiny blood vessel in her brain to rupture. While the test didn't directly cause the stroke, it placed excessive stress on her already fragile vascular system, contributing to the event. How to protect yourself. Before agreeing to an exercise stress test, discuss the following with your doctor. Is this test necessary right now? If you're not experiencing symptoms like chest pain, shortness of breath, or fatigue, ask whether the test can be deferred or if a less invasive option is appropriate. Are there safer alternatives? A nuclear stress test, which uses medication to simulate exercise, or a resting echocardiogram, which evaluates heart function without physical exertion, may be better options for seniors with cardiovascular risks. What's my personal risk? Share your history of high blood pressure, heart disease, or prior strokes, and ask how these conditions might affect the test safety. Can we monitor closely? If the test is necessary, ensure that medical staff are prepared to stop it immediately if you experience symptoms like dizziness or chest discomfort. By exploring these questions, you can determine whether the benefits of the test outweigh the risks for your specific situation. If you're still watching this video and finding these insights valuable, please comment number 3 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. 3. Endoscopies. Routine but not always risk-free. What it is and why it's done. An endoscopy involves inserting a flexible tube with a camera into the body to examine areas like the esophagus, stomach, or colon. It's commonly used to investigate symptoms like heartburn, abdominal pain, or changes in bowel habits, and to screen for conditions like ulcers, polyps, or cancer. For seniors, endoscopies are often recommended as part of routine screenings, such as colonoscopies for colorectal cancer. The hidden risks for seniors. While endoscopies are generally safe, they carry unique risks for older adults, particularly when sedation is involved. Here's what you need to know. Sedation risks. Most endoscopies require sedation to keep you comfortable. However, sedatives can cause fluctuations in blood pressure and heart rate, which can be problematic for seniors with cardiovascular issues. These changes can increase the risk of complications like internal bleeding or silent strokes, especially in those on blood thinners, e.g., warfarin, aspirin, or Plavix, which are common among seniors. Medication interactions. Seniors often take multiple medications, including blood thinners, antihypertensives, or diabetes drugs. These can interact with sedatives or affect the body's ability to clot, raising the risk of bleeding during or after the procedure. For example, a small biopsy taken during an endoscopy can lead to prolonged bleeding in someone on blood thinners. Fragile systems. Age-related changes, such as thinner blood vessel walls or reduced organ resilience, make seniors more susceptible to complications like perforations, tears in the digestive tract, or infections. A 2021 study in gastroenterology found that patients over 65 had a 3 to 5% higher rate of complications from endoscopies compared to younger patients, with sedation-related issues and bleeding being the most common. A real-life example. Imagine a 68-year-old woman on blood thinners for atrial fibrillation who undergoes a routine colonoscopy. The procedure goes smoothly, but the sedation causes a temporary drop in her blood pressure, which triggers a small clot to dislodge and travel to her brain. She wakes up feeling fine but experiences subtle neurological symptoms a day later, which are later diagnosed as a minor stroke. While rare, such cases highlight how routine procedures can have unintended consequences in vulnerable populations. How to protect yourself. To minimize risks, take these steps before an endoscopy. Ask if it's essential. If you're asymptomatic, discuss whether the endoscopy is truly necessary. For example, routine colonoscopies may not be recommended for those over 75 unless specific risk factors are present. Review medications. Inform your doctor about all medications, especially blood thinners. They may need to adjust your regimen before the procedure to reduce bleeding risks. Explore sedation options. Ask if a lighter sedation or no sedation is possible, depending on the procedure and your comfort level. Discuss alternatives. In some cases, non-invasive tests like stool-based colorectal cancer screenings or imaging studies can provide similar information with less risk. By having these discussions, you can ensure the procedure is tailored to your health needs and risks. The bigger picture. Making informed decisions. These 3 tests, CT scans with contrast, exercise stress tests, and endoscopies, are powerful tools that can save lives when used appropriately. However, they're not one-size-fits-all, especially for seniors with complex health profiles. The key is to approach each test with caution and curiosity. Here are overarching strategies to protect yourself. Be your own advocate. Don't hesitate to ask your doctor why a test is needed, what risks it carries, and whether alternatives exist. A good physician will welcome these questions and work with you to find the safest approach. Know your health profile. Keep a detailed record of your medical history, including conditions, medications, and past reactions to procedures or drugs. Share this with your doctor before any test. Weigh benefits versus risks. If a test is recommended just in case, but you're feeling fine, ask whether it's truly necessary or if monitoring your symptoms is a better first step. Seek second opinions. If you're unsure about a recommended test, consult another doctor to confirm its necessity and explore other options. By taking these steps, you can ensure that medical tests serve their intended purpose, protecting your health, without introducing unnecessary risks. Stay informed, ask questions, and prioritize your well-being. In 2021, a comprehensive meta-analysis published in the prestigious journal Gastrointestinal Endoscopy revealed a concerning trend among patients over the age of 65 undergoing sedated endoscopy procedures, such as colonoscopies or upper endoscopies. The study, which aggregated data from thousands of patients across multiple institutions, found a statistically significant increase in transient ischemic attacks, TIAs, commonly referred to as mini-strokes, within 72 hours post-procedure. While these TIAs were not classified as major strokes, they served as critical warning signs of temporary disruptions in cerebral blood flow, potentially signaling a heightened risk for more severe cardiovascular events in the future. One particularly illustrative case involved a 76-year-old woman who underwent a routine sedated colonoscopy for colorectal cancer screening. Before the procedure, she exhibited no neurological symptoms and had a relatively unremarkable medical history, aside from controlled hypertension and daily low-dose aspirin therapy for cardiovascular protection. However, approximately 48 hours after the procedure, she developed alarming symptoms, including slurred speech, difficulty forming coherent sentences, and impaired coordination in her right arm. She was rushed to the emergency room, where diagnostic imaging and clinical evaluation confirmed she had suffered a mild ischemic stroke. The medical team hypothesized that the combination of transient hypotension induced by sedation and her ongoing aspirin use, which affects platelet function and clotting, created a perfect storm for a thrombus to dislodge and travel to her brain, precipitating the stroke. This case underscores the potential for seemingly routine procedures to trigger serious complications in vulnerable populations, particularly older adults with underlying risk factors. While endoscopy itself is generally considered a low-risk procedure with a high safety profile, the interplay of factors such as advanced age, sedative medications, and concurrent use of anticoagulants or antiplatelet drugs can significantly elevate risks. Sedation, often achieved with agents like midazolam or propofol, can cause transient drops in blood pressure, which may compromise cerebral perfusion in patients with pre-existing vascular vulnerabilities. For older adults, whose cardiovascular systems may already be compromised by age-related changes like arterial stiffness or subclinical atherosclerosis, these fluctuations can have serious consequences. This does not mean that endoscopies should be avoided altogether. Far from it. These procedures are invaluable for diagnosing and preventing serious conditions like colorectal cancer or gastrointestinal bleeding. However, patients and their healthcare providers must approach the decision to proceed with caution and intentionality. If an endoscopy is recommended as part of routine screening, e.g., a colonoscopy every 10 years for colorectal cancer screening in asymptomatic individuals, patients should engage in a thorough discussion with their physician to weigh the necessity of the procedure. Key questions to ask include, is this test essential at this time, given my lack of symptoms? And are there non-invasive alternatives, such as fecal immunochemical testing, FIT, or CT colonography, that could effectively monitor my condition? For patients with no alarming symptoms like unexplained weight loss, rectal bleeding, or persistent abdominal pain, less invasive options may suffice, particularly for those with risk factors like advanced age or polypharmacy. If you're still watching this video and finding these insights valuable, please comment number 3 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Moreover, patients must proactively communicate their full medication list to their healthcare team, as drugs like aspirin, clopidogrel, or warfarin can increase the risk of bleeding or clotting complications during or after sedation. Specific questions to pose include, should I pause my blood thinner before the procedure, and if so, for how long? And, what are the specific risks of sedation for someone with my medical profile? For those wary of sedation, it's worth exploring whether the procedure can be performed with minimal or no sedation, as lighter sedation protocols or even unsedated endoscopies are viable options in certain cases, particularly for diagnostic procedures that do not require extensive intervention. Shifting focus to another diagnostic tool, magnetic resonance imaging, MRI, scans are widely regarded as a cornerstone of modern medical diagnostics, offering unparalleled insights into the body's internal structures without the radiation exposure associated with CT scans. MRIs are frequently used to evaluate conditions ranging from musculoskeletal injuries to neurological disorders, often enabling early detection of abnormalities and potentially averting the need for invasive surgeries. However, when contrast agents are employed to enhance image clarity, additional risks emerge, particularly for older adults and those with compromised kidney function. The contrast agent most commonly used in MRIs is gadolinium, a heavy metal that enhances the visibility of blood vessels, tumors, and other structures. Under normal circumstances, gadolinium is excreted by the kidneys within hours of administration. However, kidney function naturally declines with age, with glomerular filtration rate, GFR, decreasing by approximately 1 milliliter per minute per year after age 40 in healthy individuals. For those with undiagnosed or known chronic kidney disease, CKD, the kidney's ability to clear gadolinium may be significantly impaired, leading to prolonged retention of the metal in the body. This retention has been linked to a rare but debilitating condition known as nephrogenic systemic fibrosis, NSF, which primarily affects patients with severe kidney impairment. NSF is characterized by progressive fibrosis of the skin and connective tissues, leading to painful thickening, hardening, and restricted mobility. In severe cases, it can impair breathing, affect internal organs, and significantly reduce quality of life. Beyond NSF, emerging research has raised concerns about gadolinium deposition in the brain and other tissues, even in patients with relatively normal kidney function. A 2019 study published in Radiology followed over 2,000 patients aged 65 and older who underwent contrast-enhanced MRIs. Within 1 week of the procedure, approximately 5% of participants reported neurological symptoms, including headaches, blurred vision, dizziness, balance difficulties, and cognitive fog. While these symptoms were not indicative of full-blown strokes, they were concerning enough to warrant further investigation, particularly in patients with underlying kidney dysfunction. The study highlighted that many of these individuals had undiagnosed mild to moderate CKD, emphasizing the importance of screening for kidney function before contrast administration. A poignant example involves Harold, a 79-year-old retired veteran from Arizona who sought medical attention for chronic lower back pain. His physician ordered an MRI with gadolinium contrast to thoroughly evaluate potential spinal abnormalities. Unbeknownst to Harold, his kidney function was compromised due to undiagnosed stage 3 CKD. 2 days post-MRI, he experienced persistent lightheadedness, generalized weakness, and difficulty concentrating, symptoms that persisted for nearly a week. Subsequent blood work revealed his reduced GFR, prompting Harold to reflect, "If I'd known about my kidneys, I would have pushed for a different approach." His experience highlights a critical gap in patient education and pre-procedure screening. To mitigate these risks, patients should advocate for themselves by asking targeted questions before agreeing to a contrast-enhanced MRI. A key inquiry is, can this MRI be performed without contrast, and if not, why is contrast necessary? In many cases, non-contrast MRIs provide sufficient diagnostic information, particularly for conditions like joint injuries or certain brain abnormalities. If contrast is deemed essential, patients should request a glomerular filtration rate, GFR, test to assess kidney function beforehand. This simple blood test can identify individuals at risk for gadolinium retention and guide safer imaging decisions. Additionally, patients should disclose any prior adverse reactions to imaging studies or contrast agents, as these may indicate heightened sensitivity. Finally, we turn to the routine carotid artery ultrasound, a non-invasive test often recommended for older adults to screen for stenosis, narrowing, in the carotid arteries, which supply blood to the brain. On the surface, this test appears benign. It involves no radiation, needles, or contrast dyes, and it takes only 15 to 30 minutes to perform. However, for asymptomatic individuals over 60, routine carotid ultrasounds can inadvertently set off a cascade of interventions that may do more harm than good. Carotid artery stenosis, caused by the buildup of atherosclerotic plaque, is a common age-related finding. Studies suggest that mild to moderate stenosis, 50 to 69% narrowing, is present in up to 10% of adults over 70, often without symptoms like dizziness, vision changes, or transient weakness. While severe stenosis, greater than 70%, may warrant intervention in symptomatic patients, the management of asymptomatic moderate stenosis is far less clear-cut. A landmark study published in the New England Journal of Medicine tracked over 3,000 asymptomatic seniors with moderate carotid stenosis. The results were striking. For many, surgical interventions like carotid endarterectomy or stenting offered little to no reduction in stroke risk compared to medical management with statins, antihypertensives, and lifestyle modifications. Alarmingly, a small but significant proportion of surgical patients experienced perioperative strokes or other complications, such as cranial nerve injury or bleeding. Consider the case of Helen, an 82-year-old Pennsylvania resident who underwent a routine carotid ultrasound during a general checkup, despite feeling perfectly healthy. The scan revealed 65% narrowing in her left carotid artery, prompting a referral to a vascular surgeon. Within weeks, she underwent a carotid endarterectomy. Tragically, during the procedure, she suffered a small perioperative stroke, resulting in permanent right-sided weakness. Reflecting on her ordeal, Helen remarked, "I wish I'd known that leaving the narrowing alone might have been the safer choice." To avoid such outcomes, patients should approach routine carotid ultrasounds with skepticism, particularly if they lack symptoms. Key questions to ask include, what specific findings are we looking for, and how will they change my treatment plan? And, if narrowing is found, what are the risks and benefits of surgery versus medical management? For those already managing cardiovascular risk factors with medications and lifestyle changes, additional testing may offer little actionable benefit. If a scan reveals stenosis, patients should resist the urge to panic and instead seek a second opinion from a vascular specialist to discuss conservative management options, such as serial ultrasounds to monitor progression, before committing to invasive procedures. In summary, while diagnostic tests like endoscopies, MRIs, and carotid ultrasounds are powerful tools, they are not without risks, particularly for older adults. By engaging in informed discussions with healthcare providers, advocating for pre-procedure screenings, and exploring less invasive alternatives, patients can make empowered decisions that prioritize both safety and efficacy. As we wrap up, let's take a moment to reflect on the importance of being proactive about your health. You've just learned about 5 common medical tests that could carry hidden stroke risks for seniors, from CT scans with contrast to routine carotid ultrasounds, and the critical questions you need to ask your doctor to stay safe. Knowledge is power, and now you're equipped to make informed decisions that could protect you or your loved ones from unexpected complications. So, what's one key thing you've learned from this video that you'll bring into practice in your life? Maybe it's asking about safer alternatives to a test or checking your kidney function before an MRI. Drop that one thing in the comments below. We'd love to hear how this information is making a difference for you. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel, Health 365, for more insights to keep your well-being first.